The laparoscopic mini gastric bypass, or one anastomosis gastric bypass, is the newest bariatric procedure around. It's been around and used for roughly around 10 years at the moment, and it's producing some very good results. And it's a bit of a mix between the sleeve gastrectomy and the Roux-en-Y gastric bypass. It's a halfway house between the two operations. The surgery itself is done using keyhole surgery under general anesthetic, 5 cuts on the tummy, and what we do is we go in and we staple the inner aspect of the stomach to create a long pouch, roughly the thickness of my thumb, but twice as long as the standard pouch that we use in the standard Roux-en-Y gastric bypass. And then what's involved is that we take a loop of small intestine and join it onto the pouch, and that's the end of the operation. So what happens after the surgery is the small pouch will help patients to eat smaller portions of food, so it helps patients to feel fuller quicker after eating, and that food is diverted to the lower parts of the intestine, where it leads to release of good hormones that affect the feeling of fullness after eating and help to maintain that fullness. And these are the hormones also that help to switch off some of the obesity-related medical conditions, such as type 2 diabetes. The operation in the main can take around an hour 15 minutes to do, and the recovery is absolutely fantastic afterwards. So patients will be nursed on specialist bariatric wards. Most surgeons now employ an enhanced recovery after surgery protocol, where patients will be up and walking within 3 hours of the operation, drinking the same day, and on average most of my patients will stay overnight in hospital and go home the next day. As part of preparation for the mini gastric bypass, patients will have a consultation with one of the consultant surgeons in clinic. Following this, they will have support and specialist assessment from a specialist dietitian, a psychotherapist, the bariatric specialist nurse will all be in touch. The whole team from Tonic will be in touch with the patients to prepare you for your forthcoming mini gastric bypass. Part of the preparation also may involve doing a specialized liver shrinking diet, so that's an 800 calorie a day diet, low carbohydrate, low fat. In most patients, we use it for around 2 weeks before surgery, but sometimes a little bit longer if the BMI is higher. And following the operation, patients will need to be on a specific diet to help healing, so 2 weeks of liquids only, 2 weeks of pureed blended diet, 2 weeks of soft, easy to chew diet, and then patients will be able to have standard textured food afterwards. The first clinic appointment after the surgery will be around 6 weeks after surgery, 6 to 8 weeks, and the Tonic team will book that in for patients automatically, and at that appointment they'll be seeing the consultant who did the operation. They'll have a review of how they've got on for the preceding 6 to 8 weeks, the foods that they're eating, address any issues or queries that arise, and make sure that patients are taking the appropriate nutritional supplements and medications after surgery. The mini gastric bypass is a tool to help patients maintain long-term weight loss. Most of the weight loss occurs in the first 9 to 12 months after surgery, and on average patients can expect to lose around 30 to 35% of their total body weight in that period of time, and then the mini bypass will help patients to maintain their weight and to remain at a steady weight going into the future. Specifically related to the mini bypass, because patients will be eating small amounts of food, long term they will need to take additional supplements, and they will be asked to take a daily multivitamin tablet, an iron supplement every day, a calcium vitamin D tablet, and to have a 3 monthly B12 injection from their GP. And patients will need to stay on that regime lifelong in order to get a good result from the operation.